Good day. We will now be discussing common outpatient department cases. Majority of cases complaining of blurring at the outpatient department are usually due to errors of refraction. The following types of errors of refraction usually present with blurring when looking at distant objects. In myopia, the image formed falls in front of the retina. This may be due to a long eyeball or a steep cornea. In contrast, in hyperopia, the image formed falls behind the retina. This may be due to a short eyeball or a flat cornea. In astigmatism, because of an irregularly shaped cornea, instead of forming one image onto the retina, multiple images are formed on the retina. Normally, we can quickly shift focus from a distant object to a near object. However, as we age, because of the loss of elasticity of our crystalline lens, we start to lose this ability. This now is what we call presbyopia.
Presbyopia develops when our eye's natural lens loses its flexibility. Focusing up close becomes more difficult. The eye's ciliary muscle contracts, which causes our flexible lens to thicken or change shape. This change in shape allows us to see objects up close. As we age, our lens becomes less flexible and resists changing shape, so our ability to see up close is diminished. Usually, the first sign of presbyopia is the need to hold a newspaper or other reading material at arm's length to be able to read them.
This table shows the amount of accommodation that we lose as we age. A cataract is clouding of the naturally clear lens inside our eyes. Cataracts usually present with gradual blurring. They should not be readily entertained as a differential in patients complaining of sudden blurring. Some patients complain of glare and extra sensitivity to light. Other patients describe a cataract as like looking through a yellowish lens. In contrast to the angle closure type, the open type of glaucoma usually presents with minimal symptoms. One of the earliest findings is enlargement of the optic cup.
A normal optic nerve is made up of more than 1 million tiny nerve fibers. With glaucoma, as the optic nerve is damaged, it loses nerve fibers. As a result, the appearance of the optic nerve changes. We refer to this as cupping. As the cupping increases, blind spots begin to develop in your field of vision. Ophthalmologists use a technique called a visual field test to look for these blind spots.
Patients with diabetic retinopathy usually do not have any vision complaints early on in the course of their disease. It is very important to stress the need for screening and serial follow-up on these patients. Hypertensive retinopathy is usually asymptomatic. In contrast, a retinal vein or a retinal artery occlusion should always be suspected in patients complaining of sudden, painless loss of vision. Note the difference between the retinal finding of a central retinal artery occlusion versus a central retinal vein occlusion.
The inner eye is filled with a clear jelly-like substance called vitreous. As we age, the vitreous becomes less like jelly and more like liquid. Usually the vitreous is only loosely attached to the retina, so as the eye moves, the vitreous moves away from the retina without causing problems. Sometimes, though, the vitreous pulls hard enough to tear the retina. Fluid passes through the tear and lifts the retina off the back of the eye. This is called a retinal detachment.